Good afternoon, everyone. My name is Lisa Holland. I'm in the Communications Department at Families USA. Thank you for joining us for our media briefing, Healthcare at a Crossroads, Trends for 2021. You're going to hear today from Frederick Isasi, our Executive Director, who will discuss what to expect from the Biden administration on healthcare. He'll also reveal his healthcare trends for 2021 and how they will play out on the state and federal levels. Afterwards, we'll take questions. You can ask questions by posting them in the chat box or by using the raise hand feature, which you can find under the participants tab. And then you'll turn on your mic and camera to ask your question. My colleague Adina Marks will call on each participant. So we'll go ahead and get started, and I'm going to turn it over to Frederick.
Hi, Lisa. Thank you so much for a lovely introduction and for gathering together folks from the press to have this discussion. We're very excited. I'm going to go ahead and share my screen so that folks can see. We have a visual that kind of represents what we think the big trends for healthcare in the coming year are going to look like. So here we go. So a lot to say about this year and 2022 in healthcare. It is no small thing to say that in many ways, healthcare has taken over the national agenda for our country. We really are at a crossroads, both politically, in terms of our health, in terms of our economy. And we think there's four key priorities with regard to healthcare that are really going to be at the center of the national, federal debate, and in many cases, state capitals as well. So the first thing to really talk about is, of course, the COVID-19 pandemic. Hard to understate the magnitude of this pandemic on our nation. We've had about 27 million people become infected. Nearly 500,000 people in our country have died. We have been universally, I think, critiqued for the response of the previous administration to the pandemic. And I think what we've seen is that President Biden and Congress understand with the new leadership that the first job of the president and of elected officials has to be dealing with the COVID pandemic. So what we see right now is a really singular focus on making sure that we are providing the kind of relief for our nation's families that are needed to get us past the pandemic. This is very much about making sure that science is at the center of the response. As we know, the pandemic is changing every day. Our response from a scientific standpoint has to be able to evolve. So we're seeing a real emphasis on the idea that science has to lead our response. We also see a lot of focus on the idea that our health and our economic well-being are intertwined, and that a lot of people, because of the pandemic, have lost their jobs, millions upon millions of Americans, and also have lost their employer-sponsored coverage. So another central part of the COVID relief package has to be ensuring that families really can have economic security as they try to stay healthy or get healthy. And that means not just that they can afford to get screened for COVID, treated for COVID, but also that they have supports if they have to quarantine, if they have to go in the hospital. And of course, as we say all the time, COVID is just one illness, and Americans across the nation are still getting plagued with heart disease and cancer and all the other things that affect families. And so in this time of economic uncertainty, it's really important, and what we see in the COVID relief package is a real emphasis on making sure that coverage itself is affordable, either through a support for additional subsidies in the health insurance exchanges, or through support for employer-sponsored coverage with COBRA, and of course, for folks who don't have access to either, for lower income families, the ability to get care through Medicaid. So we think that's really important. We strongly support the Biden administration focus on this. It is job one. And once we can get past the pandemic, we'll see the economy really rebound and a lot of other things fall into place. So it's job one. The second thing is just a renewed push. We've done a lot of research in the last 6 months, both message testing and polling. And what we know is that this is probably the time in our nation's history where the interconnectedness of health and economic security have never been clearer, as well as the notion that our health is all connected. My health is dependent on your health. But this idea of health and economic security really have come to the fore. The polling research that we've just completed that we'll be releasing in a few weeks clearly indicates that the American people across the political spectrum are deeply concerned about the affordability of their health care. In particular, their premium costs and the cost of prescription drugs, the cost that private hospitals and other hospitals are charging, the input prices for health insurance premiums. So there's an enormous amount of concern from families. These are Democrats, Republicans, these are independents. There is no real political leaning on the issue of affordability in healthcare. And so we hope, and we are certainly pushing very hard for the Biden administration to take that concern very seriously and to pass reforms this year that will really address affordability. And that, of course, includes things like strengthening permanently the subsidies available in health insurance exchanges, ensuring that Medicaid expansion can move forward in states that haven't expanded yet. It also involves things like addressing the input prices. We really cannot get to a rational system of universal care for all in our nation if we aren't dealing with the rapidly escalating healthcare costs. And that is everything from HR 3, which Speaker Pelosi put forward last year to allow the government to finally get in and negotiate drug prices for Medicare recipients and others. But it also is important provisions around hospital prices, the new ban on surprise billing, which we were very involved with last year, which really guarantees that health insurance coverage does provide financial security. You can't get hit by a massive, unexpected surprise medical bill. But it's also things like the all-payer claims database and the transparency requirements that were part of the final end of the year package last year. So this idea of ensuring that health and economic security go hand in hand is really important. I'll talk a little bit about this more in our fourth theme, which is value. The third is equity. And we know, both because of the really powerful and important racial justice movement that has swept the nation after the terrible death of George Floyd and others, and the really disparate impact of COVID-19 on communities of color, both infection rates, hospitalization rates, and death. We have, I think, as a nation, really awoken to the fact that health is not equal. Access to health and the health of people is not equally available to all. Most Americans strongly support the idea that health is foundational. Every family should have access to health so that they can live their fullest life, and that we should be running at addressing the disparities in not just the systemic racism within our society or within the healthcare sector, but also the underlying social determinants of health that are so, that control at least 80% of a person's eventual experience of health in their life. And the research we've done indicates that both there's an opening, an awareness in the American public of these ideas of social determinants because of the pandemic. There's been a real awakening to how much one's environment, one's ability to, for example, protect themselves in their job or take care of their kids when they're trying to go to school, but also things like a person's BMI, their ability to get healthy food, their exposure to allergens and asthma. All those things play into their ability to survive COVID. And the American public are becoming more and more aware of the fact that simply getting the world's most expensive MRI does not actually provide most American families access to health. So really important. There's also, I think, a renewed understanding of the role of communities of color and immigrant communities in our nation. And there's been a real acknowledgement of their role as frontline workers, protecting our food supply, keeping our hospitals clean, keeping our trash being collected, all of the jobs that allow the fabric of society to continue during a pandemic. And there seems to be a more open mind among some to the idea that we should guarantee that every living soul in our nation has access to health and health care to protect them, their families, to honor the hard work they do every day, and to make sure that we are as protected from things like a pandemic as possible. So very excited to see this. I think that we're seeing the Biden administration really running at this question of the disparities in COVID. There's a really big push right now around vaccinations and ensuring that we really understand what the obstacles for communities of color to getting vaccinated are, and we address them right away so that we don't, in a time of of scarcity of vaccinations, we don't end up by default creating greater and greater disparities. There's also, I think, a really important discussion to have around our fourth theme, which is value. And here, this is the great sleeping giant of for this year and has been for many years now. Fundamentally, we are providing additional federal dollars to support the affordability of healthcare for American families, incredibly important. Really supported not just the strengthening subsidies for low-income families, but also middle-income families, making sure that folks all the way up to 5% of poverty are getting, or above 400% of poverty, are getting support so that there's a cap on the total amount of their income they have to spend on premiums. It's really important. That's in the COVID relief package being considered right now. But underneath all of this, if we just continue to address their premium costs by subsidizing them, we are threatening the long-term stability of a universal system of coverage. We have to get our hands around the ever-escalating costs of healthcare, and in particular, input prices around prescription drugs, around hospitals, corporate physician groups, and the like. And one of the things we know for sure is that in the last 10 years, we've done a pretty good job of eliminating some of the frivolous care that was being provided, the excess amount of care. But as we did that, the research shows very clearly that the individual price of care has been going up very quickly, 3-4 times what it was a few years ago, a really outrageous amount. And that is at the heart of it because of fundamental distortions in the healthcare sector that hospitals and corporate physician groups and prescription drug companies are taking advantage of. And it's really important to say that these, in almost all instances, these are distortions in a free market that were created by Congress. Things like the ability of prescription drug companies to abuse their patents, to extend them, to evergreen them, to make small changes that have no value at all or very little value to an individual or a family, but can skyrocket the cost. It's about keeping information for American people so that we can understand, is this aspirin, which is very inexpensive, better, worse, or about the same as this very, very expensive drug to help me deal with, say, my high blood pressure or my heart disease? The industry's worked very hard to keep that information away from us as consumers and researchers. It's time for that information to be unleashed. We also know that hospitals have been consolidating in the last 10 years an enormous amount. That consolidation has led to really abusive market share that is one of the main culprits of this ever increasing price. So all of those things underneath the effort to get to a universal just system of healthcare, this is probably the greatest threat. I think that many people think it's the ambivalence of some lawmakers, and I would say that's incorrect. I think it's actually the abuse of the healthcare sector on price and the ever-escalating cost of healthcare that is not connected in any way to quality that is really the main threat. And so fundamentally, the big question for this year is, are there going to be any real substantive value reforms as part of the congressional agenda from the Biden administration and from congressional leadership? And these are really tough fights. Obviously, one of the biggest questions on the table is, will HR 3 or some version of the ability to get in there and negotiate a fair price for American families for drugs, will that be a part of the agenda in the next year? We're pushing very hard that it will be. Obviously, it has enormous opposition from the prescription drug industry. This is a David and Goliath, much like the spice billing fight last year, a complete David and Goliath in terms of money, concentrated power. But the American people, Democrats, Republicans, Independents, 85 to 90% of the American people want this to happen. So it's really important. We're going to be pushing very hard on that. Another example of a big question mark is around public option. And public option is really about two things. It's about affordable health insurance premiums, but it's also about, depending on how it's crafted, the ability of the government to get in there and negotiate a better price for families. And so there's a lot of discussion about public option as well. As you guys know, the Partnership for America's Healthcare Future has brought together insurers, private hospitals, and prescription drug companies, all unified in opposition to anything that looks like a public option. It is very clear they're trying to protect all of those market advantages they have, the monopolies, the distortions that don't create competition, that allows them to leverage no competition. And so we'll be working very, very hard in that fourth area of value. I think it's largely going to depend on political will and also the necessity. So for example, if we're doing big reforms in Medicare, creating a new oral health care benefit, for example, or vision or dental, if we're creating additional subsidies and exchanges, those are very expensive policies to enact, need very large offsets. And so part of this will be the yin and the yang of wanting to put additional federal support in making healthcare affordable for families, biggest political win we could possibly see coming out of the Biden administration and Congress, against the really heavily moneyed and concentrated power of industry to oppose the potential offsets like public option and prescription drug negotiation. So those are kind of just big picture where we think things are headed this year. With that, let me stop sharing my screen. And I think we'd be happy to take as many questions as folks might have.
Yes, thank you, Frederick. So now we're going to open up for questions. You can drop those in the chat. So far, I don't see any. And then also noting that the infographic image that Frederick shared on his screen, that was the link to that infographic is in the chat. Thank you, Adina, for putting that there. So you can drop your questions in chat, or if you'd like to ask them on camera, you can go to the raise hand feature under participants, and Adina will call on you. Okay, no questions. Going once, going twice.
Oh,
All righty. Oh, here we go. One in chat. This is from Steve Finley. Hello, Steve. How are you? Are we in a new era with regards to moving away from employer-based coverage? What does your messaging show on that?
So I would say we are not in an era where we're moving away from employer-sponsored coverage. I think what we see are the same trends as always, which is small employer coverage is very unstable, and people are often constantly cycling out of coverage for firms of less than 50 people. For large employer, it remains very stable. I do think employer-sponsored coverage is one of the most important dynamics in the value push. I think it's really important that the Hill and President Biden are thinking carefully about how potential value reforms like prescription drug pricing or a public option could benefit employer-sponsored insurance, so that they could bring in the political clout and the interests of the 70 million plus Americans who are getting coverage that way. That's a really important dynamic. It hasn't quite been solved for yet, and I think we're working really hard on making sure that we're building those kinds of linkages in these policies so that large employers, small employers can show up and really support the value reforms as well. And there's a lot of synergy there. We have, in our messaging alliance, we have both large and small employers who are all very, very excited around these four themes, but in particular around value.
Great, thank you. And thank you, Steve, for asking that question. And we do have another question from Meryl Guzner. What about the new level of subsidies in the Biden COVID relief package? Do you think it's sufficient? Do you support without corresponding measures to promote value?
Great question. We are wildly supportive of what President Biden has put into the COVID relief package because it does two things. It ensures that coverage is more affordable for the most vulnerable Americans. Those are folks below 400% of poverty, in particular, folks below 200% of poverty. That's very, very important. Those are the people who have been hit hardest by the pandemic. They're the most likely to have economic insecurity. And so small costs in terms of premiums or cost sharing can devastate those families. So the notion that we're providing additional protections for them, really important. But we also are very, very supportive of the fact that they lift the cap on subsidies above 400% of poverty. The federal poverty level is fairly antiquated and not particularly sophisticated measure of income. And we know that in a lot of communities, the buying power of a dollar can vary greatly. For example, between, say, Omaha and DC, or rural North Carolina and New York City. And so the notion that you have people who may have higher annual incomes, but in fact are living with more economic stress, is a true dynamic. So ensuring that folks up and down the income scale have the ability to have a cap on the total amount of their income they have to spend on premiums is very, very important. We really support that. It's also politically really important. These are those folks tend to be very active politically and voters. So it's also that's another important dynamic. We think it's really appropriate that they're in the COVID relief package, and as written, they do sunset, and they are not matched with corresponding value provisions. We think that that's perfectly acceptable. We're in a pandemic and both a health and economic crisis like we've never seen before. So this should be immediate, and it should be embraced. However, we do strongly believe that if in the second reconciliation package we see additional affordability provisions, particularly making permanent the provisions that are in the COVID relief package, additional supports for Medicaid, additional supports for COBRA subsidies or ESI, in doing that, they should be paired with really well-reasoned, strong policies that will address pricing abuses by the healthcare sector. That will not only provide strong offsets, but it also will create a more stable system of coverage.
Thank you, Frederick, and thank you, Meryl, for the question. And we'll just see one more time, anybody has any additional questions. Okay, also from Meryl, what are your thoughts on how to curb pricing abuses? Really good question.
So I think we've got to take a multi-pronged approach. The first thing is we have to understand one of the places, or the two places where the American public, the polling that we've done show very clearly, the public is most focused on their premium cost and their prescription drug costs. Those two elements are the part of healthcare spending that people experience personally every time that they have it taken out of their paychecks or they show up at the CVS down the street and fill a prescription. So the idea that prices are most politically viable for addressing when they have created a consumer outrage is a really important concept. What we're seeing right now is a lot of effort, both on the part of hospitals and on the part of prescription drug companies, to try to shield consumers from their abusive price increases. So one of the things that's really important is to help the public understand with a lot of clarity, with a lot of good information, how abusive these health systems and these prescription drug companies, corporate physician groups have been around pricing. We think the all-payer claims database that was enacted last year and is being stood up this year could be a really important tool in that. We are looking for disruptive innovations, things that will change the debate, help unveil the abuses and get people activated. And we think that could be one of them. We also think that fundamentally, the effort towards value is really about two different things. The first is addressing the market abuses, asymmetry information, monopolistic pricing, externalities to the delivery of health insurance, for example, that most of us get coverage through Medicare when we get older and we're sicker. There's a whole kind of set of issues within the healthcare market that have to be addressed. The second is, however, understanding the way in which our traditional fee-for-service healthcare system is driving towards terrible outcomes. And so another piece of this really is about re-engineering the financial incentives so that they actually hold the system accountable for health and not just units of disconnected healthcare, not just the world's most expensive MRI, but really, an effort to say your job system is to either keep me healthy or get me healthy when I get sick. And that is really about changing payments and incentives. That's about what's often described as migration to risk, meaning providers go to risk for keeping a population healthy or getting them healthy, not just simply providing units of care. That has the potential for really transforming the experience of most families in trying to achieve health, because it brings in the social determinants. It brings in things like behavioral health, housing insecurity, substance use disorder. It brings in things like coordination of care and the importance of primary care. So, in systems that are doing this, what you see is when you have an older, say, someone's mom who is in their 80s and has dementia and has fallen in and broken their hip and goes in for surgery, a very, very common occurrence and often a comorbid occurrence with something like dementia. When they get discharged, they're not just getting discharged home and it's good luck to them. They're getting discharged after evidence-based falls analysis has occurred in their home. They've created a safer home environment so they don't fall again. They have folks who are calling and coordinating to make sure they're showing up for their follow-up appointments. And there's even things like passive monitoring, where when that mom goes to get a cup of coffee in the morning and she goes to pour it from the coffee cup, there's a pad weighing her. And if she has a swing in weight, which is one of the quickest indicators of changing health status, it's going right to her primary doctor without her having to do anything. There's all kinds of really interesting innovations that can occur if we move the healthcare system away from thinking about health as units of care and rather holding them responsible for healthcare. So we're very excited about both sets of reforms, both addressing the fundamental distortions in healthcare and really thinking about the new ways that the healthcare system can be held accountable for health and not just as units of healthcare.
Thank you, Frederick. And again, thank you, Meryl, for that question. Then we have one last question from Steve. Paid leave movement is gaining steam. How interlinked with coverage? How interlinked is this with coverage expansions and other healthcare reforms? And then he asked another question. Seema Verma launched a bunch of stuff on value at CMS. Do you see the Biden administration retaining some of those initiatives?
Sure. So let me take both really quickly. So on the first question, which is paid leave movement, it is absolutely related to health. It is about the ability of families to get a healthy start. It's about getting a solid foundation. There's incredible evidence about the ways in which the very first days of a baby's life can really put that child on a trajectory towards health or towards adverse health. And in particular, the evidence around adverse childhood experiences, which are just a collection of very negative experiences that small, and we're talking about pre-2-year-olds, can experience all the way up until 6 or 7. The correlation with those experiences in early childhood leading to what is often termed as highly complex care superutilizer status, where an individual has really complex comorbidities, everything from obesity, substance use disorder, other mental health issues, all coming together, is incredibly powerful. And so paid family leave is just one of the steps towards trying to provide a really strong early start for babies and families. Really important. Nurse-family partnership, which is also in the COVID relief package, really, really important as well. Very strong evidence to support it. So we're very supportive of those things. And I do think the COVID relief package shows you a lot of these interconnected social determinants. The housing focus in the COVID relief package to support the ability of families to stay in secure housing during the pandemic, incredibly important. Also heavily correlated to health outcomes. So what we're seeing is sort of an opening of the mind, the collective mind of the public towards all the ways in which health is connected to these underlying supports. So we're very supportive of that. With regard to CMS and CMS administrators' efforts around value, some of it was, we would say, was completely wrong-headed. And it was on very weak science, things like work requirements in Medicaid, which have been proven over and over again, not only to be illegal, but to be completely counterproductive and not allowing families to live a healthy life, but rather putting up barriers to their health. So I think those things we're seeing quickly go away. But as you guys know, there was a lot of really vigorous activity at CMS, particularly within Medicare and within CMMI. Some of those things I think will continue. I think Administrator Verma was very committed to trying to help providers who are ready to get closer to a fully risk-based payment, meaning that they can find out, sort of, here's my patient population. I'm going to take on a risk-based payment for them, say, $1,000 a person for my maintaining their health and helping them get healthy. And then I can innovate underneath that capitated payment. There were a lot of innovations in that regard that I think will continue. They may continue with some modifications, but the drive towards allowing providers who can bear the risk to run at much higher risk profiles is, I think, going to accelerate. And I would say our position on that is that we need to help invest in market disruptors. Those are typically not the number 1, 2, or 3 health systems, or sorry, not the number 1 health systems in a market area. It's usually the 2nd or 3rd health system. And those folks are looking for ways to provide care differently, to attract new patients. And in some markets, they are ready to want to absorb a larger patient population, absorb more of the risk for making sure they stay healthy. We should be tripling down on that with the right kind of safeguards around patient privacy protections and making sure risk adjustment is strong and not penalizing communities that are disadvantaged. But beyond that, we think it's a really important innovation, and all signs point to that really getting accelerated by the new leadership within the Biden administration.
Thank you. We did get one more question that we'll follow up offline about, because we are a little bit over and we want to just keep to time. So I want to thank everybody for joining us today. I want to thank Frederick for a really great discussion. And if you have any questions, please feel free to follow up with me. I'm sure you already know my email address, but it's lholland@FamiliesUSA. We'll send around the recording and the info link and link to the infographic. And Meryl, like I said, we'll follow up with your question offline. Thanks everyone for joining us. Have a great day.
Thank you. Thanks, Lisa. Thanks, everyone.